peripheral site, IV site dressing, and then the second one is to discontinue the IV. Okay, we need to gather our supplies. So in order to change the peripheral site dressing, you are going to need clean gloves, a Tegaderm or Opsite, and my gloves. Okay. Gloves, Tegaderm or Opsite, clear. Tape, which I have, and gloves. Okay, so you're going to do CG wipe, explain the procedure, and I'm going to don clean gloves. And I am going to look on my MAR or on my flow document to see when this is changed. Or I'm going to inspect the site and I'm going to decide that I need to change the op site dressing. And there are 3 reasons I might do that. Anybody?
Signs of irritation.
Irritation. Irritation, inflammation, so it turns red. What else? How about if it's leaking? Okay, if the IV is leaking, or if there's blood collected around the site, right? And so then we would change the dressing, because we don't want it to be moist or wet or contaminated. So the first thing I would do when you're looking at your IV, you will notice that it's secured. The IV tubing is secured usually someplace on the arm so that if the person would jerk it, it stays. And the second place is there's tape across the hub. Okay, the Opsite only covers the needle hub, not the IV tubing hub. They're divided in two because then you would not be able to disconnect. Okay, so you're going to keep your finger over the cannula hub and you're going to gently remove the tape and the Opsite. This is not going to go. Okay, but I would remove that. I'd remove the tape first, and when I am done, I will have an IV cannula that is just sitting there, which I want to treat very carefully. If I need to, I can use alcohol wipe or iodine, and I can wick away any of the debris and soak up the fluid. But I want to keep this as sterile as possible. Okay? When that is dry and the site is secure and ready, I will take off my gloves and I will open a new Tegaderm, which is the hardest part here. And the Tegaderm is sterile. Looks just like an Opsite. When you have it, comes in a little window. Okay. Remember, you want to now, once the Opsite is removed, you want to apply this Tegaderm in a way that it is only on the hub of the needle, of the cannula. It's not on the IV tubing. And you secure that around the cannula and the tubing, and it's nice because then you can see, you can assess your site when you need to. Okay? The second part of that then is to secure the tubing, and I like to use a smaller piece of tape that they're not allergic to, and that is securing the hub of the IV tubing to the skin. And if the tubing is not secured in another site, I would secure that as well. Now you need to document what you did, and usually on your head to toe assessment on your flow sheets there is a site for the IV. What type of IV, what is it being used for, what date was it started, and every 72 hours your IV has to be changed, the site has to be changed. So the next thing we're going to do is we're going to discontinue the IV, and so we would do the same thing by doing CG wipe, getting our supplies, and this time we need a 4x4 and a piece of tape, or we need a Band-Aid. And we need another pair of clean gloves. And we would remove the cannula with our gloves on, use a sterile 4x4, which I like to bend into fourths for pressure, put it on the site, remove the cannula, and use a piece of tape, and you hold it for 2 to 3 minutes. You would then document on your flow sheet that you have discontinued your IV and the date and time, but you also want to give an assessment of the site. Was it red? Was it infiltrated? Is that the reason it was discontinued, or was it discontinued because of an MD order? Then it's no longer needed, or because you needed a new site. Any questions?